Gady Abramson, chiropractor here in Florida for the last 18 years. It's our beautiful office. The other offices are just like that. We are using the best equipment and the best techniques, which is one of the reasons why Google rates us the highest in the area or in Florida. We do have over 500 5-star Google reviews, and it is because our goal is for you to fully recover as soon as possible. And you also notice that when we provide the therapies to you, they are longer than what the statute calls for. They're not 8 minutes, they're not 15 minutes. Oftentimes they will be 40 minutes per modality, sometimes more. If you want to come here twice a day, by all means. We have always offered a second visit on the same day at no cost to you and or the carrier. Why is stretching the back so important? And why and how can it be so easy? Let's see. Discs, cartilage, ligaments, and tendons, what do they have in common? They don't have blood vessels to innervate them. So they have to have special attention. That's true for the back and any other joint in the body. They should be at rest. When we wake up, we either sit or stand. And what happens, especially to the discs, they have the natural pressure from our weight on them as we sit and or as we stand. Imagine a sponge that you put under a faucet, but you press the sponge down. How much liquid comes into the sponge? Not a lot in comparison to if you open the sponge and let it absorb as much water as possible. A process called imbibition or diffusion is a process where some interstitial fluid goes into the disc. That can only happen when the disc is at complete rest, which happens when we lay down. You can accelerate the process if you actually stretch while you're laying down, and then more fluid will come into the disc, will allow it to rehydrate and to be healthier. Shortly, we'll see the process, how it takes place, how easily it can take place. So let's see what happens with the disc at various times of the day. Here is a model for two vertebrae, disc, nerve roots, spinal cord. When we sit or stand up as soon as we wake up in the morning, we have pressure that compresses the disc, and some of the fluid comes out if you stand and or if you sit. When you do the decompression, it alleviates the pressure and allows more fluid to come into the disc and rehydrate the disc. To properly stretch your back, which is actually really easy to do. Anybody who has a pulse can definitely do it. What my recommendation for you to do it, I'm doing it for the last 23 years. Assume that this is your natural bed. This is just a bench for demonstration. Sit like I'm sitting right now. Your knees are bent, your feet are all the way to the ground. If your bed is high, they're almost all the way to the ground. Now use both elbows to climb up. The pelvis completely relaxed and numb. You will kind of move your shoulders climbing up. That will cause a little stretch for the vertebra. And let's see how it's being done. When I finish the stretch, I continue pressing with the elbows and climbing down. The way I get off the bed is look at my feet, and I'll press down this way. This was another stretch. My recommendation is that any time you go into bed, if it's just going to sleep, if you went to the bathroom somewhere at night, once or twice, if that's what it takes, every time you go back, use that technique. That technique can also be applied on the grass, on a carpet, anything that is not smooth, so then traction can actually take place. This is a decompression table. In that setting, it is set to decompress a neck. The neck piece is being removed it can actually decompress your lower back. The purpose of the decompression is to allow more space between the vertebrae so there is less pressure on the nerves.
I recently moved here to Florida, probably about 3 years ago. I have been to chiropractors most of my life, since probably 12 years old. I was very nervous because of running into chiropractors that have cut corners here and there. And we came here. This is my first visit, and I'm very pleased. I was very excited with his adjustment. I definitely will be back. And I've had chronic problems, and he did such a great job. I'm really happy to find him. I was very nervous actually coming today, and I'm very pleased.
At one time, I messed my back up and I blew a disc out. So I had to have surgery. And the surgeon, the chiropractor I had up there said, I've done the best I can do, but coming down here, you want to find somebody. And I went ahead and explained my, issues that I've had before. He listened to them. I mean, you usually don't get that from the places that are just wham, bam, snap, crackle, pop, and you're done. So I came in here, and I was very surprised, very happy. It's very clean, very taken care of in that. They're very professional, very courteous. And they seem like they're more dealing with you as being a person rather than you being a number.
My name is Gady Abramson. I've been coming here for a little bit over a year. I went to another chiropractor and they did a couple adjustments, and right away they diagnosed me and said I needed to come to physical therapy. I didn't feel like I needed that. I just needed someone to adjust me properly. Found this doctor. He agreed to be here when I got here. He knew what pain I was in. And right away he treated me. And in one session, he took care of everything. All the pain was gone. Obviously I had a little residual pain, but everything was mainly gone. And so, he told me from the first appointment, my main goal is to never have to see you again. Other doctors, they want you back, they want to make money. Dr. Abramson is very good at what he does, and he wants to make sure more than making money, his patients are feeling good.
My name's Donald. Been going to a chiropractor a long time. Moved down to Florida, needed to find a good chiropractor. Had him up north that we went to for a long time, my family, and came down here, ran into a couple that made me worse. I went ahead and found Dr. Abramson. I could hardly walk. He got me up and walking.
You should see a chiropractor maybe at least once a year minimum, just to make sure that you're in good physical health. Your body's very important. Your muscles, your spine, everything's aligned. It could really change the way you conduct your day. It makes you feel good during the day. I think it's important. You don't necessarily wait till you're injured to see the chiropractor, because even if you're having a headache, it could be something internal that you don't know about. It's good. It's worth checking out.
First time I got hurt in my back, my cousin, he's recommend me on Gady Abramson. He's amazing. The experience was actually, I feel like a brand new right now. You can see about my smile. If you got something, you know where to go. I really recommend, highly recommend. Thank you so much, God. Thank you, everyone. Everyone here is so passionate, so very, very fun to come here. Thank you so much.
Actually, I thought the office was closed during COVID. I realized that they're open, and obviously feeling a little skeptical about coming to a doctor's office where most patients go. I see the way they take care of the facility. Doctor sprayed everything down twice with two different disinfectants. I mean, the office is a brand new office. It's spotless. I feel very comfortable being here. I would highly recommend Dr. Abramson. Before making this video, I didn't even realize he was doing any sort of filming. I'm kind of, doing this from the bottom of my heart, but I even left him a review the day after I left his office last year. And because I wanted people to know how good of a doctor he is and how much he really cares about his patients.
Oh no, definitely all chiropractors are not the same. I've been to many. You know, like back in Michigan, I lived in Michigan originally, and he was a really good chiropractor that we went to at that point. And but prior to him, there was definitely some difficult ones, but definitely recommend Dr. Abramson to all my friends and family for sure.